So the idea of this study was basically, we know that the APOE4 allele is the main genetic risk factor for sporadic Alzheimer's disease. And although it's very well established that the carriership of the APOE4 genotype associates with increased amyloid beta burden, there are many evidence that there are much evidence going and on the last few years showing that APOE also contributes to Alzheimer's disease pathogenesis through amyloid beta independent pathways, such as vascular pathways, tau pathology, and many pathways that are independent of amyloid beta. And although let's say the amyloid beta related pathways are much more well established, these other pathways that are independent of amyloid are still poorly understood, let's say like this. And on this study, we aim to investigate. The idea was that besides increasing amyloid beta burden, there are studies showing that APOE exacerbates the effects of amyloid on cognition. And from animal model studies, there was studies suggesting that perhaps this could occur through tau pathogenesis. And because of this, we aim to access, and also considering that cross-sectional studies showing an interaction between the APOE4 genotype with amyloid beta on tau pathology. These were cross-sectional studies in humans. Here we aim to study the association of amyloid beta with APOE4 carriership with tau pathology progression. I think this was the idea here. So basically here we aim to access, as I said previously, whether APOE4 carriership potentiates the effects of amyloid beta on tau pathology progression. And to do this, we studied 104 individuals from the McGill triad cohort across the aging and the Alzheimer's disease clinical spectrum who had available clinical assessments, the APOE4 genotype, MRI, amyloid beta PET, and also tau PET at baseline, and also a follow-up tau PET. And what we observed was that basically the APOE4 genotype potentiated the deleterious effects of amyloid beta on the longitudinal accumulation of tau tangles, mainly in the neocortical regions that were corresponding to black 3 to 6. And after that, what we did was that we aimed to assess whether pathological tau phosphorylation could mediate these APOE potentiated effects of amyloid beta burden on tau tangle accumulation, on the longitudinal accumulation of tau tangles. And for that, we accessed pathological tau phosphorylation using plasma p-tau 217. And what we observed was that actually the APOE4 potentiated amyloid effects on tau tangles were in fact mediated by an increase in plasma p-tau 217, suggesting that perhaps the effects, these deleterious or these APOE4 potentiated effects of amyloid beta on tau tangles occur through tau phosphorylation. And lastly, what we observe is that, okay, so what's the clinical relevance of our findings? I think that's what we always ask ourselves when we see this, what this tau accumulation, when we have increased tau tangle accumulation, what this means. And what we observed here was that an increased tau accumulation was paralleled by higher rates of cortical atrophy and also higher rates of clinical deterioration.